Hello, Dr. Preston coming to you from the Nortel Spine Center. And today I just want to cover what the most common condition that we see here in our practice is and how we approach treating and getting that condition to resolve. So likely if I had to say what is the most common condition that I see here on a day-to-day basis, on a week-to-week basis, in multiple cases, it has to be sciatica conditions. Pain down the leg, pain down both legs sometimes, and that intensity can range from mild to moderate to even severe. And we've seen cases come in here as bad as not being able to walk, cases that were relying on crutches, cases that were relying on their spouse, of course. And we've even seen some, unfortunately, on a walker where you thought, wow, this person had likely a stroke. But it turns out it was a sciatica condition. Now I'll tell you, what makes us really successful in treating these types of conditions is we go after the root cause in terms of what is putting pressure for that nerve to react in that sort of manner, right? What I have found that is very common when it comes to these conditions is that it's not resulting from a leg issue or even a hip issue, all right? If you trace it back and figure out where this is actually coming from, it is the lower spine. And likely, many times, it results from having compression of the lower spine, of the low back. And typically what gets compressed in the lower spine over time, and some people are just more prone to this and others based on different circumstances, it's going to be those spinal discs. When those discs get going and they get compressed and they get thin and they tear and herniate, the thing is there's nerves that come off the spinal cord that sit right there. So if that disc protrudes or herniates out, many times it's big enough and large enough to where it starts to kind of lean into a nerve and create chafing of that nerve. So what needs to happen is that part needs to change as much as possible and retract in, without surgery of course, to get that to respond well and to get the patient relief. And that's what we do in our practice. And these machines back here are responsible for that, right? These are the state-of-the-art machines when it comes to spinal decompression machines. Not every machine out there is created equally. What we have found is these machines, these DRX machines, give the patient the most relief, the most change in the quickest amount of time possible. And the nice thing about this is that it's longer lasting. It doesn't fade off like an injection. It doesn't have side effects like pain medication. And like I said, it gets excellent results without causing more pain and discomfort. And patients love it. So these machines, what they actually do is that they go in and focus on the area and isolate the disc, the level where the disc lesion is or lesions, and it creates a difference in the pressure inside the disc itself when you're on the actual machine, when you're being stretched. Now that stretching, what it does, it separates the vertebrae in a controlled manner. As it does that, the pressure inside the disc itself converts down to a negative pressure. It goes from positive to negative, and that ends up creating a suction or vacuum effect of the area of the disc where it's herniated or bulging out. And as it does that, it creates a suction mechanism, and the disc slowly retracts in as much as possible. And we have found that by doing that, it alleviates the nerve, the area of the nerve where the disc is sitting on, and finally that nerve can start to respond and heal and function correctly. So that is how we approach treating these types of conditions. Cases where they were in bad shape, cases that were living on pain meds and just increasing the dosing over and over again, and cases that were on the brink of having surgery. They all have responded really well to this type of treatment. All right. So I just want to share that with you. If you are suffering with low back, herniated disc, or like I said, sciatica conditions, please give us a call and we'd love to help you guys out. All right. Thank you very much. Bye-bye.